We're speaking to Dr. Chai Pei Fan. He is a consultant pediatric gastroenterologist from Pantai Hospital, KL. Good morning, Dr. Chai.
Good morning.
Thank you so much for speaking to us about bowel movements this morning.
Not a very nice topic to start off with.
But it's important to know about, I think.
I think before you become a parent, you don't really think about these things. But
Yeah.
after you become a parent, every bowel movement or the lack of bowel movement becomes a problem.
It's a
right?
monumental issue, right?
So, Dr. Chai, can you tell us, firstly, what are some of the most common gastrointestinal ailments that children face? Are children of a certain age more susceptible to these ailments?
Well, the common gastrointestinal problems by the different age groups. So you have the infants, gastroesophageal reflux, cow's milk protein allergy, bowel infections are common. For the toddlers, they can come with malnutrition, poor weight gain, eating disorder, and even motility problems like constipation. And of course, the older children may present with gastritis, reflux, and some with problems of irritable bowel.
I see. Now, let's talk about constipation, though, in children. How
Mhm.
often should a healthy baby, an infant below 1 year old, go for bowel movements per day?
Well, the normal for infants can really vary. Usually at birth, they can have a very frequent bowel movement,
Oh, really?
up to every feed, So it's possible to have 7 to 8 times a day, and this gradually reduces to when they are about a year old to about once or twice a day. Yeah. But having said that, a special group of infants, especially those who are fully or exclusively breastfed, they can have very infrequent stools in the first 6 months of life. So they can have like once in 2 or 3 days. And for some, can even be once in a week or two.
What?
Yeah, this can
Is
be
that
normal.
healthy?
That's normal. That's normal for this group of babies. So
Interesting.
ultimately, stool frequency alone cannot be used as a good parameter to determine whether a child has constipation.
Okay. So why these group of babies have such special bowel movements like once a week?
It's just this group of babies, they are fully breastfed. Most probably, they digest very well and lots of good absorption. So they don't produce too much stools. They probably accumulate it for a few days before they pass it up.
Okay. But as a parent, you'd start to worry if your child doesn't pass a stool after a day.
Yeah, sure. I mean, the most parents would be very concerned, but when we have a look at the child's really growing very well, and they have no other issues.
Okay.
Right? They are feeding very well. The tummy is not too distended. They don't have issues with vomiting, and everything is well except the infrequent stools. So that's quite normal.
But is that the marker though? Is that when they vomit, then only it's the beginning, or it's getting serious?
It's a normal behavior for some of these fully breastfed babies,
Okay.
and it's not too uncommon. Not every fully breastfed baby, but not uncommon as well. Yeah.
Okay. So if they were not fully breastfed, then maybe you would worry if they don't.
Definitely, yeah,
Yeah.
yeah. If they're not fully breastfed, they don't fall into this category of infants. Then, of course, if they don't pass through in quite a few days, then it's something to take concern of. Yeah.
Okay. But what are some of the other possible reasons as to why babies and children have constipation?
Well, there are many reasons, but most of them can be due to maybe some dietary changes, especially during the weaning period. Older children, once they start school, for example, school toilet avoidance, and some children do have the behavior of incomplete evacuation. And this can become the trigger factors for children getting into the problem of constipation.
Mhm.
So basically, they're just not comfortable doing it anywhere else except home,
Yeah.
right?
Yeah, they hold it for quite some time, and sometimes they lose the urge, and it just goes on. Yeah.
Like you said earlier, it has to do with diet as well sometimes, especially for older
Hmm.
children.
Yeah.
But as we know, many children, they're very picky eaters and they don't like to eat vegetables. So
Yeah.
what can we do as parents to ensure that they consume sufficient fiber?
Well, what parents can do, firstly, is to be consistently persistent, right? And secondly, still continue to be persistent and never give up.
So just continue
Okay.
feeding them
And
vegetables.
hope that they take it
Yeah,
one day.
make it positive, right? Make meal times positive, and really have some uh, positive encouragement, rather than trying to force it on them and make meal times very uh, negative experience. Yeah.
Okay.
So encourage a good balanced diet with good variety. And I believe it's very important to start them young, even at the time when they start taking solid food, the weaning period, and to expose them to a good variety of food. And when during this weaning period, it's not only important to focus on the nutrition part of it, but also the development of taste and texture acceptance.
Mm.
Many old school practices are very restrictive, and this really doesn't encourage children to accept different types of food, especially the vegetables.
Yeah. Because I mean, in Asian culture, they eat rice and soup. That's it, right? A lot of children just take rice and soup.
Yes, yes, that's the common practice. Yeah.
But should children consume supplements to, I guess, to assist their digestive health, like probiotics and things like that?
Okay, very interesting question. And let's be more specific. Let's talk about probiotics, like you said,
Hmm.
to boost digestive health. Uh, a very simple answer to that question would be no. And maybe to be more precise, we don't really know. Well, in the past few decades, we do understand more and more about our gut microflora. That means the good germs in our bowels.
Hmm.
And we also understand a lot on how using these probiotics are these good germs, and how we can modify this gut balance. But how well probiotic works and how well it works in general for the purpose of just boosting general gut health is still unclear. So which type of probiotics really works? All right. Does it work for everyone? And at which dose we should give, which strain works better, and to use it for how long? So these are the questions that are still not fully answered.
Mm. But what about like highly constipated children? Should we give
Mhm.
them a supplement of fiber, perhaps? You know, there are some fiber supplements or vegetable
Mhm.
replacement pills or whatever,
Yeah.
or liquids out there that can be given to children. Do you think that's advisable?
Well, fiber can be part of it, but I think we really need to know what is the main cause of the constipation, and trying to solve the problem rather than just adding more fiber, because fiber may not be the problem for all children with constipation.
Oh, interesting.
Yeah, because when we were kids, I remember our parents would say, just eat papaya and you'll be fine, and then you'll go. Does it still work the same way nowadays?
It works for probably most, but probably not everyone.
Interesting. Now, this entire topic actually came up because my own son has problem with bowel movements.
Going.
And he's had this problem since he was a baby. He was breastfed for only 3 months, and he started solid at 5 months. And even during the time when he was fully breastfed, he would probably go only like once, maximum twice a day, compared to other
Mm.
breastfed babies who go like maybe after every feed they would go, right? And when he was about 6 months old, he didn't have a bowel movement for a total of 6 days.
Oh my God.
And I brought him to the doctor. Pediatrician recommended like a tablespoon of prune juice and a bit of water, but that also didn't help him go. So the question here is, doctor, what might be the problem in this situation? And if there are parents out there right now with their babies in a similar situation, what can they do?
Well, like I said, if in those infants or babies who are fully breastfed, not passing stools for a couple of days may be normal, provided that they don't have any other issues. But for those who really have an issue with constipation, if it's just a few days, yes, you can try natural laxatives, prune juice, like you've mentioned, drink more water, and can use the different types of juices, and of course, take more fruits and vegetables. And if that fails and it's still persistent, then probably you need to seek medical attention, right? To find out what would be the possible underlying cause as well. Very rarely, it can be due to bowel conditions that need specific treatment. Like, for example, babies born with a condition where they do lack nerves to control the bowel movements, right? So after examination and assessing the child, if none of the significant problem is found, then we call it just what we call functional constipation. So in children with functional constipation, the use of child-safe stool softeners would be recommended. In fact, it's important to identify them and treat them right appropriately to prevent the constipation from getting worse or becoming chronic.
Mm.
But can I go back to the point where the babies or the children don't have nerves to make them want to go? How do you solve something like that? Is it common?
Well, it's not common. It's not common, but it's something that we look out for, especially in children with a lot of issues with constipation. It's not something very common, but it's something that we do really need to find out if they really have this kind of condition. And the treatment ultimately probably would be some minor surgery to correct the problem. Yeah.
Wow.
Okay. That's quite scary.
Intense.
Okay, back to my son
Okay,
now.
so yeah.
Even as he got older, from about 2 to 3 years old, he only went once every 4 or 5 days. And that was very worrying because, I mean, he ate well. He drank a lot of water. He doesn't like to eat vegetable, but he does eat some kind of fruits like apples,
Mhm.
bananas, and papayas.
Papayas, yes.
Yeah, and at this point, I think it's more about the anxiety of going, because after so many days, right, surely the stool would be a bit harder and it would
Yeah,
be painful to pass. So
that's
how
right.
do you deal with a child who is resisting the urge to go?
Okay, these children go into what we call a vicious cycle of having hard stools, painful passing of stools, and then they develop this withholding behavior.
Mm.
So with the withholding behavior, it results in more hard stools, and it just goes into a cycle. So the treatment for this kind of children is firstly to break this cycle, clearing them of any impacted stools, and to do what we call a complete evacuation.
Okay.
This is followed by keeping the stools soft, that so that they can pass regularly until the good bowel movements are restored, and also making sure that no more painful experience to reduce the withholding behavior.
So do we use a suppository? Because some parents have actually told me, oh, just use a suppository and then they'll be fine. But you have to use it all the time, After 5 days, if he doesn't go, then you have to use the suppository.
Well, there are many options. We try not to use suppositories. If we can use certain oral stool softeners or laxatives. And I think we really have to have a good plan and to get them out of this vicious cycle, we call it.
Mm, mm. So, what else, doctor, can I do to help him go to the toilet at least once every day?
Well, the question is, does he really need to go once a day? Because sometimes for older children, how old's your child
He's
again?
he's 4 turning 5 this year.
Well, okay, it's 4 turning 5. So for a child that age, sometimes their normal can be just once in 2 or 3 days. If they don't really have any symptoms, then it's probably not a problem.
Okay.
But if for any reason you really need, uh, your child to be a bit more consistent, then what we can do is to encourage what we call some bowel training, right? So
Wow.
this involves encouraging them to go uh, to the toilet at a regular time, right? The best time would be probably after a meal. We make use of what we call the gastrocolic reflex, meaning that when we eat, our bowel starts moving,
Mm-hmm.
and our large bowel tends to move as well. So after a good meal, usually it's easier to it's easier for the bowels to open. So after dinner is a good time. Usually it will be less rush as compared to probably other meals. So if your son can follow that and his bowel can develop a more regular habit, most likely he'll be able to be more regular. Okay.
Okay.
So no one said that.
So your point here is maybe every day after dinner, just make it a habit to just sit in a toilet for a little while and see whether or
Yes, and sometimes they do
not he
catch that
goes. Okay.
regular habit. Yeah, that's correct.
But if he doesn't, it doesn't mean that there's something wrong.
Yes, if he has no other problems and he's got no other symptoms, maybe that's just him. Yeah.
Yeah. So is this inherited somehow? Because my daughter, she goes regularly. Even from a baby,
What is
from when
regular though?
every day she will go twice at
Okay,
least,
okay.
like once in the morning and once
Mm.
at night. And for my son now, it's about once every 3 days.
Yeah.
And I mean, is this hereditary? Do they follow the patterns of their parents or things like that?
Mm, well, it can run in the family, but
Constipation can run in the family.
Or in this case, not run.
Okay. So it is normal, doctor, for children for some children to go up to 3 times a day and for some to only go once every three
in
days.
3 days, yeah. So
Yeah.
the normal for adults and the older children can be 2 to 3 times a day to 2 to 3 days once. Yeah.
Is diet all to be blamed, or is it the workings of what's inside the gastrointestinal system?
Like I say, it can be a mixture of trigger factors and reasons. So you can't really blame the diet for everything,
Mm.
but most of the time it's part of the problem. Yeah,
Okay. I remember you saying irritable bowel syndrome much earlier just now.
that's
And
right.
we found out that IBS also can cause constipation, not just
Going too
purging.
much.
Yeah,
Yeah.
not just going to the toilet.
Yeah, there are a few types of irritable bowel. There are the types that the more common ones usually is just a lot of
Diarrhea, right?
diarrhea. Yeah, but there can be some with a mixture of diarrhea and constipation.
Does your son ever have diarrhea?
Never.
Never, right?
Never.
Oh wow.
Okay. But I mean, children sometimes they cannot describe to us where the pain is coming from, the abdominal pains that they experience. So, what can parents do before rushing them off to the emergency room if they complain of a stomach ache?
Well, depends on how bad the stomach ache is, and of course sometimes. Besides looking at the description of the pain, parents can look at the effect of the pain. For example, looking how the pain affects the child, the child's not able to do his or her normal activity, disturbing classes, going to school, and not able to sleep, or even suddenly awaking at night in severe pain. And of course, trying to figure out, which location the pain is, more of upper tummy pain or on the right side, for example, and how meals, whether it's after meals or before meals, affect the symptom. So besides, looking at the description of the pain, maybe, they can also ask questions or look into how severe the pain is in terms of how it affects the child.
Okay. Now, finally, doctor, how can we as parents, how can we help ensure that our children have healthy bowel movements and digestive systems?
Well, encourage them to eat well, good balanced diet, not only fiber, but other nutrients as well. And most important of all, I think as parents, we should show good example. I've seen many parents complaining that their children are fussy eaters, and when you ask them how they eat themselves, they probably don't eat much fruits and vegetables as well. So I think as parents, we should show good example, make meal times a happy time, a happy meal, right? And of course, not to forget that children also need a good amount of physical activity and exercise to keep everything in balance. Yeah.
Oh, yeah, that's important as well, I
Yeah.
guess. Yeah.
But generally, doctor, even for adults, rule of thumb is if you eat 3 times a day, should you go 3 times a day?
No,
No, not
not
necessarily.
necessary. Not necessary. Yeah.
All right.